Welcome back, everyone. Kristin is back with us today. She is from Lima Memorial Health System's Pulmonary Medicine. We're talking a little bit about November's Lung Cancer Awareness Month. If you could talk a little bit about the prevalence of that ailment, both locally and across the country.
For sure. So November is Lung Cancer Awareness Month. It's very important, especially in our community. So the leading cancer cause of death in the United States is actually lung cancer, which is double the amount of colorectal cancer death in the U.S. Here in the Allen County, we actually have a higher prevalence of lung cancer than the, Ohio average. And so it's very important for us to spread the word about lung cancer awareness here in Allen County and the surrounding counties, because we are having that higher risk of death than even, the average in the United States.
I know one of the things you guys talk about and you focus so much technology on is early screening and early diagnosis. Talk about the importance of finding this early.
Correct. So lung cancer itself doesn't become symptomatic until it's late stage. And so the earlier we can find these cancers, we're looking for cures, not necessarily treatment and, chemo and everything like that, but we're looking for a cure. What can we do to save your life? That way you don't have to go through all of these treatments and, the side effects, and we can decrease the death rates that we have here in Allen County in Ohio.
Yeah, what a great goal. As you mentioned, catch it early and focus on survival and getting through it. What do you guys do at the hospital as far as meeting that goal of finding it early and the technology you have?
Yep. So we here at Lima Memorial, we do have a lung cancer screening program. It's called a low-dose CAT scan. It uses about 80 to 90% less radiation than a traditional CAT scan. It's completed as an outpatient. It takes about a half hour. No IV, no dye, anything like that. And there are certain criteria that a patient has to meet to be able to get screened. And so most insurance companies have changed so that way this year we can screen between the ages of 50 and 80. And you have to be either a current smoker or a past smoker within the last 15 years and have at least a 20-pack year history, which means you either smoked 1 pack for 20 years or 2 packs for 10 years or more than that. And so if you qualify for that, we offer this screening program that most insurances cover as a screening. And so there's very little to no copay involved with these screening tools that we have.
Yeah, that's always good news to hear. We always wonder about the cost of it, too. You mentioned low-dose CT scanning. Does that take a picture of the lungs? What kind of things does it look for, and what kind of an image do you guys get?
So we get very thin slices. We're able to scroll through them and look for any incidental lung nodules, things that people are not symptomatic with. We also look at the lymph nodes, too, to make sure that those lymph nodes aren't enlarged in the lungs, because cancer, the first place it's going to metastasize to is in those lymph nodes within the lung. And so if that's true and we see that, then we can biopsy early. Or if it's something that's small that wasn't there last year, we can monitor that with a screening within 3 to 6 months.
You mentioned some of the people that would be applicable for that procedure and getting that look. What do they need to do if they're watching this and they think, hey, you know what, that criteria, I meet that criteria, I'd love to sit down with them. What's the next step for them?
They can always go to their family doctor. Family doctors are able to order this just as well as we are. If they already have an established pulmonologist, we are more than happy to order this for patients. I love educating patients on this and urging everyone, that qualifies for this to get this done, because it really is a life-saving tool.
Great information. Kristin, it makes you so optimistic to hear the technology you guys have and what you can do. Thank you so much for telling us about it. We appreciate it.
Yeah, thank you for having me.
You bet. Nice chatting with you. We'll be back right after this.